That we are taping tonight's presentation for potential future use. So I just want to be above board on that. So I'm telling the panelists that too, in case they're unhappily employed or something. You might want to watch that. Good evening and welcome to our Opioid Awareness panel discussion. We really appreciate all of you coming out for this important conversation. My name is Kathy Medrick, founder of Kutztown Strong. When we put out the call to action in 2014, we were alarmed by the plague of heroin in our community. We had lost too many recent graduates. We've worked really hard over the past 9.5 years, and yet we still have a devastating problem. The number of drug overdoses in Pennsylvania in 2022 was almost 2.5 times what it was in 2012. In 2015, the book Dreamland by Sam Quinones came out. He made it clear that heroin had become a pervasive problem across all socioeconomic groups. He wrote that addicts, quote, were the daughters of preachers, the sons of cops and doctors, the children of contractors, of misuse primarily among youth, but no age is unaffected. The rate of overdose deaths quadrupled among older adults, 65 and older, from 2002 to 2021, according to a study published by JAMA Psychiatry. Fentanyl has replaced heroin as the favorite opioid on the streets. A hit costs less than a 6-pack of beer, and it's 50 times stronger than heroin. But fentanyl isn't the end game. There are new, more powerful drugs emerging all the time. You'll hear about some of those from our panelists tonight. And by next year, there will probably be new names of drugs as the front runners. We use the Pennsylvania Youth Survey, commonly known as PAYS, that is available to all Pennsylvania districts to identify risk and protective factors for our students. Then we examine ways to bolster our protective factors, minimize our risk factors through research-based practices. Through PAYS data, we know that 44% of our youth are challenged by 5 or more risk factors such as depressive symptoms, low commitment to school, and inaccurate information on the harmful effects of misusing substances every day. 5 risk factors every day for every student. Unfortunately, in recent years, national surveys of youth have shown major increases in certain mental health symptoms. From 2009 to 2019, the proportion of high school students reporting persistent feelings of sadness or hopelessness increased by 40%. Because mental health and substance misuse often occur codependently, we wanted to ensure that families had supports they needed. We developed a community needs survey through a partnership between Kutztown Strong, Kutztown University, and Friend, Inc. We gathered data from the Kutztown Area School District, the Brandywine Heights Area School District, and the Fleetwood Area School District. The responses on that survey told us that families were having difficulty accessing resources and services for improving the mental health of our youth. The community needs assessment indicated that the greatest necessities for families across the 3 districts were supports in the area of financial management, accessing out-of-school programs, and mental health for counseling. Whether or not the needed resources are present, they are not necessarily available to those who need them most due to timing, transportation, finances, or other factors. We have made progress and continue to evaluate data that we collect on the risk and protective factors. 87% of our youth now view substance use as an unacceptable social behavior, which is a 13% improvement. 89% of our youth are not accepting of their close friends using drugs, which is a 12% gain. We've strengthened our partnerships with our schools, connected with nonprofits like Communities in Schools, and done a lot of fundraising and grant writing to nearly double the number of behavioral health services available to our children through our local schools. We're proud to have made a difference, but we know we have so much more work to do. Tonight, we have some very knowledgeable panel members with us. Among them, they have a breadth of expertise, experiences, knowledge, and we are grateful to them for donating their time and energy to help us get this crucial information out to the community. Each panel member will provide a brief snapshot of who they are. You probably can't all see their name tags, but they know who they are. So they'll tell you who they are, facts about their role in working with substance misuse, anecdotal information, and suggestions on what needs to change in the future and what we as community members can do. Because we want to ensure that there will be plenty of time for the audience to ask questions, each panelist will restrict his or her comments to 5 minutes. As they're speaking, if you have questions, please write them down on the index cards you got as you entered. Kutztown Strong members will collect those when the panel members are done speaking. And if you need additional index cards, or if you have a question to hand in later, just raise your hand and someone will come assist you. Could the Kutztown Strong assistants who are here, please stand up. So these are the people who will come around and get your cards. I would like to point out a couple of people. Sue Collier is our president, and Cheryl McElveen is our coordinator of everything. So anyway, and everybody else is extremely important, but I don't want to take all the time. So we will be collecting questions to ask you later. And the reason we're collecting the questions is we weren't sure if you'd be able to hear questions from the audience, and we ran out of mics, so we can't pass one around. So I am now going to turn it over to our panel members, and we'll start with Marcia Goodman-Hinnershitz and go down the line. And they will tell you what they know, and you can write down questions as they're speaking. Thank you.
Okay, and good evening. And first of all, a real thanks to Kutztown Strong and the journey that this community has taken over the past 10, 15 years, and the courage to be able to respond to a problem which many communities would have wanted to bury their head in the sand and not look at. So my name is Marcia Goodman-Hinnershitz. I have a long name and I have a long title. I'm the Director of Resource Development and Planning for the Council on Chemical Abuse, the agency that coordinates drug and alcohol services for Berks County. And my role is really specific to be able to keep the pulse on current problems and to be able to then help and support communities as they mobilize to be able to address the problem. So I've had personally and professionally a long-time relationship with Kutztown Strong. I was honored to write the first grant to the Pennsylvania Commission on Crime and Delinquency that helped the seed money to get Kutztown Strong started. And in that, I learned so much about your community and want to be able to continue to be part of the dialogue. As Dr. Metrick said, we look at data, but we also look at what is deep in people's hearts. And that's what's important, is to connect with the people and their stories. So I thought I would start out today. When I was asked to speak, I was asked, well, what do you know about working with older adults? Being one at this point in my life journey, I can really relate. But I can also relate from a personal perspective that many times we don't look at the issues facing our older adults. And many times we look at the issues of illegal drugs, and we don't look at the fact that a lot of our older adults have been prescribed very powerful opioid drugs to deal with the pain. When you spoke about the book Dreamland, our problem with opioids started, unfortunately, with our pharmaceutical industry making an enormous amount of profit over promoting drugs like oxycodone, the Percocets. And our older adults got trapped in that, okay, because they were told, this is the quick fix for your pain. And let's face it, when we get older, we're going to be in pain. That's just part of the aging journey, okay? But our older adults were told that these weren't addictive, when in fact we know very well that they're highly addictive drugs and very dangerous. From a personal perspective, my mom suffered from, and God bless her in heaven, she suffered from spinal stenosis. Her doctor, without understanding the impact, was prescribing her Percocets and oxycodone. And indeed, she became addicted to the drugs. But at that point in her life, we weren't as knowledgeable as we are now about the effects. So when she was taking her drugs and believing she could take them as needed, which isn't how you take drugs, you take them as they were prescribed, she ended up not overdosing, but ended up going through withdrawal when she ran out of her drugs. And the hospital at that point didn't identify that. We're at a much better place now because of all our good resources that have pulled together in Berks County, that what my mom had to experience going through withdrawal and not being treated for that, not being identified with an opioid use disorder, that's no longer happening. We now have strong partners with our hospitals that if anyone enters the hospital with any kind of drug use, whether it be opioids, alcohol, any kind of substance, we have recovery specialists that are at Reading Hospital, Tower Health. They're actually there 24/7. They will meet with that individual, help them to navigate through getting connected with treatment, and so that person can leave the hospital, not going back home alone and isolated, but can be connected to treatment resources. So we were doing a good beginning job, but the problem isn't going away. And the reason it's not going away is there's still a lot of people that are developing opioid use disorders because of the supply that's out there, and because there's this real myth that this is going to make your pain go away, whether it be emotional pain, whether it be physical pain. People don't want to live in pain, so they take these drugs, they develop a substance use disorder, whether it be opioids or another type, and then they need the resources of treatment to help to navigate them to recovery. And it's a long process. What I've learned through this process is we need to listen to the people that have experienced the journey, people who are in recovery, people who are still using can also give us valuable information. So at the Council on Chemical Abuse, we continue to redeploy our resources to a way that we know the opioid overdoses aren't decreasing at all in Berks County. We know why they aren't. We have fentanyl out there by the ton loads, literally being brought into our county by illegal drug users. We still, even though we're seeing a decrease in the prescribing of opioid drugs, they're still out there to put people at risk. So we need to help people to navigate through, and we need to give them the tools that they need. So some things that we're doing that are a little different now is we're looking at things called harm reduction. One of the key parts about harm reduction is to reframe how we think about people with substance use disorders. I will never use the word addict anymore. That's a very demeaning way of speaking with people that are suffering from a chronic disease. But I look at the fact that these are folks just like a person with diabetes, other chronic diseases we can relate to. So we want to help those folks. And most importantly, what we want to do is give them the tools so they can minimize their risk. So now we're distributing drug testing strips or drug checking strips so people can check their drugs to find out, do they have some pretty deadly chemicals in? Is there fentanyl in their drug supply? Is there xylazine? Are there ways that they can reduce their risk so that they can then be connected to treatment? And I think with the next speaker to my right, I think she can pick up where I moved on. Very much so. Thank you.
Excuse me 1 second. I noticed some of you are writing notes of things you want to say. I'm going to pass down some index cards so you all have something to write on. Does anybody need a pen? I have 2.
So I wanted to introduce my colleague, Dr. Ramona Roberts from Caring Treatment Services.
Thank you, Marcia. Dr. Ramona Roberts, the Senior Executive Director of Regional Outpatient Services for Caring Treatment Center. So I oversee 3 of our regional outpatient offices. That's in Atlanta, Georgia, Plymouth Meeting, about an hour from here, and in our very own Berks County Wyomissing outpatient office. We treat adults and teens, of all types of substance use and for mental health. So if you know someone looking for services, we can treat them substance use or mental health, and both, because we know so much of that goes hand in hand. I think when I was thinking of what I wanted to share here, for me, it was really an effort to dispel 2 myths about substance use. One of them being that people who use substances and teens who start to experiment do it because they come from broken homes. I want to make sure that, so part of us speaking is to talk about what can we do, and some of that is just as Marcia used an example of changing the language from addict to someone who is in long-term recovery, a substance use, also changing the way we look at who uses, and I think when we look at someone who has substance use, we see the gamut of environmental situations, home environments that are, sure, maybe some of them are the quote unquote broken home. And then you have others that come from amazing families with so much love and support, financially stable, have all the resources you could think of, pretty well adjusted socially. So that's the first one, is making sure that we don't get boxed into thinking, oh, not my family member, not my kid, not me, right? And the second one is that not everyone who is using opiates is at risk, or the people who are at risk for fentanyl use and fentanyl overdose are not just those who use opiates. I think we forget about those using other substances like marijuana and cocaine. Right now, with the proliferation of fentanyl and all substances, no experimentation is safe. And I know Marcia shared a story about her family member, her mom, and I'll share with you, being a licensed psychologist doesn't make me immune, doesn't buffer me from experiences with mental health and substance use. I have a 16-year-old cousin who died of a fentanyl overdose. 2 months ago, I lost a dear friend to a fentanyl overdose, and he was not an opiate user. And he was not someone that used substances often. So I just wanted to chip away a little bit at the pictures that we may carry about who uses substances, because that will shift who we look at as being at risk. Some of the risk factors were already shared. So I think parents and families, we really just need to have honest conversations about drug use. And that's difficult. Sometimes we're afraid if we talk about it, it's putting ideas into people's heads. Well, many of you remember being kids and stuff was put, in your head, stuff's floating around in your head before your parents even think to have a conversation with you about it. And it can be scary for us as adults and challenging to know how to articulate these conversations and at a developmentally appropriate level. So I'm sure there are some school professionals that can help you with that for it to be developmentally appropriate, other treatment professionals. I want to also make sure that so I know Marcia focused a little bit on older adults. I'll stay in the teen lane for a minute. I learned being a mom to make sure I don't caution my kids by saying that if your friends cared about you, they wouldn't give you drugs, right? Your friends aren't looking out for you, because you lose your kids when you tell them that their friends don't care about them. Drugs or anything else that they're doing that might not be healthy, right? If we say that their friends don't care about them, we lose a communication line, because to them, their friends are their world. And I don't necessarily think that's an accurate comment anyway, because their friends may be just as ignorant to what's happening and to the risks that are involved with any of the behaviors they're engaging in. If we think about brain development, our brains, our frontal lobes that are in charge of your decision-making, judgment, planning, impulse control, all of that is not fully formed until your mid-20s. So naturally, as teenagers, we make stupid decisions, and some that can have permanent consequences, right? So I would challenge all of us to just get a little more courageous with trying to have the conversations. I think, again, even being in this field, I have come to face with the idea of shame when I've had to deal with my own kids' experiences. I think, and that brings it really brings it home. Like, wait a minute, I'm a psychologist and I'm thinking about this For those that aren't in the field, imagine all the shame that they carry. I can't talk to anybody and tell them that my kid's having suicidal thoughts. They'll think I'm a bad parent, right? So I think just being courageous and trying to have these conversations, because that will start to chip away at the shame and the stigma, the isolation that families feel when they are touched by substance use and mental health challenges. At Caring Outpatient, we would be glad to help you with your needs from 13 and up for substance use and 14 and up for mental health. We also specialize in trauma. We know that substance use, in particular opioids, are an easy escape to pull someone out of their experiences of trauma, their symptoms of trauma. It's a really great way to avoid, unfortunately, with grave consequences, right? So we will focus on that. We have a lot of SAP, student assistant specialists that are in the schools with the care and education department that can help walk you through some of these challenges just to navigate the scene. Who do we go to? Who do we talk to? Who do we reach out for help? What's our next step? So I would just really encourage you. I think Karen highly recommends that all families and schools keep Narcan accessible. We have a supply of Narcan at our outpatient facility, as well as some of the harm reduction that Marsha shared. Having that on hand, just like you would have a first aid kit, could save a life. So I think now my time might be up. I'm going to pass it on to Donna.
All right, can you hand me if I just leave the microphone here? Is that all right? All right, great. So then I'm not going to have to hold on to it. So thank you. Thanks very much for inviting me to be here. I'm really happy to be here. Though oftentimes when I present at panels, I think that sometimes happy isn't always the best word to describe, because why am I here? My personal involvement with a child that has substance use disorder. So again, my name is Donna Jacobson. I facilitate the Lehigh Valley Parent and Family Support Group. We meet weekly in person. Families that have someone that has substance use disorder in their family and they're a direct caretaker to that person are usually the folks that come to that group. I've been doing that since 2015 as far as being a facilitator. I've personally been a member of that group, though, since 2011 when my daughter first went into recovery. Through my journey of educating myself and learning, I certainly agree wholeheartedly with Dr. Roberts is mentioning about our adolescent population, and that's where so much of this starts. So I am the president and founding member of REACH LV Youth Recovery Center. It is a youth recovery center with a location in Emmaus and a second location in Easton, a little distance for you all, but you know the Emmaus might be a little closer. REACH was formed and started to be developed in 2017 by a couple of other folks that had an outpatient facility in the Emmaus area. We felt that the containment of young kids getting together, being able to do fun, sober activities together could learn a different way of addressing some activities that our adolescent kids were participating in. So REACH stands for Recover, Engage, Accept, Connect, and Heal. And that really summarizes what we do. It's an entirely free program to anybody that comes to it. We are in Lehigh County and Northampton County. We do receive some funding from our SCA in Lehigh County, but the services are available to anyone. I've done a lot of volunteer work over these years as I became more and more educated on what my daughter's path was. Back in the time, I volunteered with the Center for Humanistic Change with a program called HOPE, which is heroin opioid prevention and education. My daughter and I both participated in that program, and it's in the schools, it's in the middle schools and the high schools in the Lehigh County, educating our families there, and so on and so forth. And you don't need to have that whole list of everything. The important thing is that I'm a mom, and I'm that exact mom that Dr. Roberts just described. My husband and I celebrated our 45th wedding anniversary. I know I look not quite that I could be married for 45 years, but 45 years we celebrated this July. So we have a fabulous home life, and I think that we provided that to our children. So what made my older daughter go down this path when she was in high school and into her first year of college? This is a disease that affects the brain. Some things that both Marsha and Dr. Roberts mentioned were, what our child is trying to maybe soothe themselves. They're looking for a way out. They're looking for some pain relief, emotional pain relief, and that's what brings them to it. Not every kid is going to get addicted. In the family, my husband and mine both, there's addiction and alcoholism on both sides of our family, and my daughter was lucky enough to inherit all of that. So what does that look like for us? Blindsided, we had no clue. We couldn't figure out what was going on with our daughter as she was finishing up high school and entering college. Some stuff kind of was like weird, but didn't really put two and two together until the following year. And a friend of mine said to me, Donna, open your eyes because your daughter is a heroin addict and probably worse. And I thought, you are out of your mind. I have no idea what you're talking about. But I quickly learned that that was very true. She went very quickly from pills, opioid pills, painkillers, to being an IV user. We were blessed to be able to get the support that she needed by getting her into treatment 3 times, but the third time was a charm. So she went into 3 different facilities, in and out within just a year and a half's time. Each time she went in for treatment, she came out a little smarter, a little wiser, a little bit more open-minded for treatment when there was a relapse. So our time was very short in comparison to some families that I work with that come to the support group that have been going through this journey for 10, 15, 20 years. Families come to our group, their child is 45 and 50 years old. So this is a lifelong chronic disease that has to be treated. What were some of the things that we had to do? In the beginning, we knew that we needed counseling. Where did we go? We found an addiction counselor. That person said to me, you need to get support for yourself. And I thought, I'm not sick. And she said, oh, yes, you are. Your entire family is. Your entire family is, and you need support. And she led me to the Karen Parent Family Support Group at the time. And I started going to that group. It was a life-changing experience for my husband, myself, and my other siblings for us to become educated. So what do we do? How do we turn this whole thing around? We had to come out of the fear and shame that we were experiencing and the isolation that we as a family were experiencing, because we didn't want to have to answer the questions of where's your daughter and what's this and all these questions, because we didn't have the answers. But we were embarrassed and we didn't know what to do. So we got educated. We went to the family support group. We continued on with counseling. Somewhere along the line, I found out that there had to be some aftercare. And when my daughter got out of treatment, we suggested she lived in a women's recovery home, and she did that for a year. So off she went to a women's recovery house where she delved into what would become her recovery, her lifelong recovery. So today we have 12 years of recovery. So for me, I have that very positive, hopeful experience that I can share with families. That's not always the case. In the years that I've been going to the support group, we were talking earlier about the amount of losses that we've had. We have sustained 36 losses to parents in our support group. This year alone, we have 7 losses since December of 2022 to about 2 weeks ago. 7 personal losses. And we're making strides. We're nowhere where we were back in 2009, 10, and 11 when this first started for my family. We are so far ahead, and yet we're still losing our folks. We're still losing our folks. So what changes do we make? We have to educate, we have to advocate, we have to take action. If we all can take action and we can speak and we can have those conversations with people, we will make changes. I know I have made changes in the community, and you can make those changes too. By looking at your families, by getting educated and being able to then spread that word elsewhere. I have a reading for you since I'm here as your mom, your family member. One of my favorite authors is Sandy Swenson, and she is just an incredible mom. She has 2 sons, one of which is does not have a substance use problem, and the other does. I'll just read to you briefly in her book, Tending Dandelions, and she says, recovery is a process that we all share. It's not only for the health and well-being of our beloved addicts. Again, I'm reading out of Sandy's book. Addict, I could just throw up saying that word. I do not use it in my language, Marsha, or anybody else that's here. The language has to change. but for our families, ourselves. On the road to recovery, we pass through several stages, sometimes again and again, all in good time. But collected, all of these meditations in this book here talk about these stages of recovery. When addiction first takes root in our child, we may be completely unaware, but once we have heaved ourselves over the monstrous hurdle of realization, the recovery journey will begin. We learn, we grow, we cry, we wilt. We learn the value of nurturing ourselves and find strength so that we can bloom. Finally, like fields of frazzled flowers, we can scatter the seeds of truth and goodness, changing the dynamic of this place where love and addiction meet. One by one after another, we're carried aloft by hope, help, and the beating of hearts of other mothers who love a child who suffers with addiction. We may often feel fragile, but we are strong and we are many, and we have the power to overpower the destruction that addiction spreads. I know you guys at Kutztown Strong have a saying of together we are stronger. Last page of Sandy's book, Together We Are Stronger. Like the wind singing through a forest of sturdy branches, let us be one strong voice against addiction. Thank you.
Good evening. My name is Walt Skavinsky. I'm a sergeant with the Kutztown Police Department. I started my career 36 years ago when I was 19. And I'm going to equate my career as a timeline for our efforts to reduce substance abuse. 1987, we had Just Say No. That was the line in high school. Maybe it was effective, maybe it wasn't, I don't know. We had the 1986 Drug Abuse Resistance Act, which put out mandatory sentencing for the possession of drugs. I started off in a low-income housing project. I then went on to the Attorney General's Drug Task Force. At that point, we began targeting the buyers of drugs in an effort to get the sellers of drugs. What that ended up with was, for every 10 sellers, we had one buyer. It was a war of attrition, so to speak. There was never any thought to helping these people recover. The people that were arrested for possession were throwaways. They did their mandatory sentences. Then I saw a different face of abuse. I started doing prescription fraud investigations. These were people who I actually knew some of the names. And they became accidentally addicted to prescription drugs, because at the time, there were a few safeguards on prescription drug issuance and monitoring. They became so addicted that they would forge prescriptions, steal them from doctors' offices, things like that. That's where I came in. I made my own efforts at trying to divert these people to recovery, because by this time I realized the arrest policies of the previous years weren't working. So most recently, in Kutztown, I thought that cocaine was the worst drug ever, and then along comes heroin. And I see a community like Kutztown with everything to live for, everything to look forward to. And we have addiction. In the very first year of issuance of Narcan to our officers, I Narcan the same person 3 times. It wasn't really enough. It was a harm reduction effort, but we needed something more. 2012, 37 Berks County residents lost their lives to drug overdoses. In 2022, years after Narcan's been introduced and handed out, 136. We're encountering drugs now like fentanyl. My Narcan still works for it. Now we're encountering xylazine. It's going to have no effect with Narcan. The only thing it'll affect is the opioids that it's mixed with. So we're looking at, we need something else. So recent efforts that have been introduced to us have been the LEDI program, the Berks County Law Enforcement Treatment Initiative. This recognize that criminal offenders are 4 times more likely to be drug abusers than the average population. Looking at that, law enforcement becomes an intercept point for people to get into treatment. If I have a low-level drug offender and all they did was possess drugs or commit a crime related to that drug possession, I can divert them into this program, ensure that they get through it, and I can stand there 24 hours a day, make a telephone call for an intake or a referral. They'll do the information over the phone. If they need detox, they'll work on getting it immediately. If it's something that doesn't need immediate interaction, they can set up a treatment plan. This is a better step for us. 2021, we came out with another program that's been successful for our department. I know several of our officers have done it. One of our officers really likes doing it, and that's the Blue Cares program. So when we get called up to go out to a drug overdose and we Narcan an individual, we often don't see what happens to them afterwards. Well, after they're released from the hospital, a member of COCA, the Chemical Council on Abuse, they come down and they'll go out with an officer and we make an in-home visit. Hand them literature, explain to them what support services are available, and talk to the family members. This puts a different face on law enforcement and gives us the ability to be a little more trustworthy in the community as far as getting people into the program. I'm out there, I see the effects of addiction on families, and I see it on individuals. I think it's very important that we as police officers have to recognize that we have a role in helping people recover, not just arresting them. And one of the biggest things I need to leave with you is, as law enforcement officers, I can't arrest my way out of this problem, and I can't Narcan my way out of this problem anymore. So we have to look for creative alternatives to divert people into counseling programs whenever we can. I'm not saying don't arrest anybody. There are people out there that are just bad people, and the arrest can interrupt the plan. But there are a lot more people out there who are just suffering, and we need to recognize that and divert them into these programs. And I have my fellow worker here for public safety, Matt. He's going to take over.
Good evening. My name is Matthew Brett. I'm the Assistant Chief of the Allentown Fire Department, in charge of EMS. Locally, for people that are local here, there's some. I'm the Fire Chief of Kenton Fire Company and also the Emergency Director for Greenwich Township. So my job is 10% administrative, and then I'm out on the street with my fellow coworkers. I don't ride in an ambulance anymore. I ride in a squad truck, and I go out and help on high acuity calls. Those high acuity calls can range from anything from a pediatric problem to a shooting, a stabbing, unconscious overdose, and cardiac arrest. So I put some numbers together, and I don't want to bore you with numbers, but I want to maybe enlighten you to see how deep the problem is and where it's going. These numbers I pulled together from 2022. I looked at some of the numbers from 2023, and we are probably about 10% ahead of these numbers. So this is just for the city of Allentown. In 2022, 1,511 overdoses. Overdoses, that's anywhere from opiates to alcohol to benzos to you name it. I think those numbers are low. Our numbers are only as good as the people charting them. We go out for many unknown problems, people that are unconscious, and it's very hard to track these numbers. We run about 19,000 calls a year. So digging through these numbers is not an easy task, but that's kind of what I came up with. And that comes to about 4 overdoses a day, which I think is low, and I'll tell you why. 80% of those overdoses, which I think is a good number, is opiate related. And it's very true. Heroin is not the fad anymore. It's done. Most of our heroin, from talking to our forensic people, we're about 7% heroin. That's because of sheer cost of it. Fentanyl is now the game in town. It's cheap. I can go to many places in the city. I can watch deals happen. children getting it outside of schools. It's a cheap drug to get. It's very readable. It's coming up mostly from Mexico. And then, like you said, somebody said earlier, it's cheaper than a 6-pack of beer and very highly addictive, which we all know. Last year, we had 162 drug-related deaths. 91% of those were associated with opioids. One of my, I'd say one of the dark days that I worked May 1st and May 2nd. And why I really know that is because part of my job is coming up with trends and how to deal with those. The first of the month is a very busy time for my service. There's a lot of government money that is handed out in the beginning of the month. And that is a fast track to dealers. The people that are selling know this and they target. I work 12-hour shifts. I worked a 14-hour shift and a 12-hour shift on May 1st and 2nd. I ran 23 overdoses in those 2 days. I suspect most of them were opiates. I can't say that now. And I had 7 deaths in those 2 days. 7 times I had to call a coroner, and I stayed with the families or patients or people that are outside so 7 in 2 days. So that's a starking number, I think. And those range from ages from a 19-year-old up to 64. So there is no target population that we see. Sure, we're going to have trends of the ones that are between 18 and 28, but it goes way up. The one kind of thing that on the bad side of this, and maybe I look at it a different way, I take the opportunity to talk to every person I deal with that has an overdose that I'm able to wake up and talk to and try to figure out why. Because part of my job is to figure out, is there a way we can do things better locally? And another hard part of my job is for my paramedics that are working on the street. He'd mentioned that he had Narcaned an individual 3 times. That's not unusual. We've had certain people that we've Narcaned woken up 2, 3, 4 times in the same day. I have an individual that I know by name. I know his birthday. I know his social security number by heart because I've taken him 52 times for overdoses. So the system is not working for that individual, and we're trying to figure out why. There's some good things that are coming out of this. I pulled some numbers. 35% of the encounters that we're seeing are getting Narcan prior to EMS arrival. So that's pretty incredible. That's bystanders, police officers, firefighters, any kind of people that are coming out of their businesses. So that's a good number. That's a good thing. Another trend that we're trying to track and keeping track of, something you mentioned xylazine earlier. That's a very potent tranquilizer that is getting mixed into fentanyl. And the reason I bring it up, we had a session about a month ago that we talked about, and xylazine was big. It was coming big in Allentown. And we all know how to treat opioid overdoses. We've been doing this for a long time, but when you start mixing in these other potent substances is when it becomes very difficult. And that was a trend. Just in the last 5 days, things have seemed to change to a different trend. Now, people that are smoking K2, I've had probably 20 overdoses in the last week and a half that are from K2. K2 usually doesn't do that. We have some other issues with people that are using K2, but now it seems it's mixed with fentanyl or some kind of opiate. But along with that, some of our medical people on the panel might be able to help me out. They're becoming very bradycardic, which means their heart rate is dropping, which is 100% opposite of what my team is used to. They're used to the person that's on a stimulant and an opiate at the same time. We fix that opiate problem, and the stimulant is crazy, and their heart rate is through the roof. Now we're dealing with people with a new drug. I'm also been working with some of our toxicologists at Lehigh Valley Hospital to try to figure this out. But the problem is we figure out the problem, and the drug people that are mixing this and selling it come up with something new. Hence the big K2 problem 2 years ago when we were dealing with 25, 30 plus K2 overdoses in a day. every time that the DEA figured out the substance that was in K2 and could start making it illegal, it was changed. Another chemical makeup was changed, and that becomes very difficult for the providers. Another difficulty that we run into is keeping the providers on an upbeat level. It's very difficult when you have the same person that you're going back to 2 times a day, 5 times a week, and knowing that they're going into a hospital, the treatment is offered. We give out cards to every overdose that we have for treatment trends in different places throughout the city, and it doesn't seem like it's working. The hospitals are overwhelmed, they're understaffed, and the mental health capability within the hospitals just isn't there. There aren't enough people. So how do we fix that? I wish I had the answer, and it's very difficult to keep my staff on an upbeat level, and also be able to continue to treat our patients with respect, because sometimes it's difficult. How many times in the same day do you have to carry somebody off the 3rd floor, where you're carrying somebody that's my size or bigger, and it's your back, and it might be the last time you're able to do that, but we have to continue to do that for the same person. So it's very difficult, and part of my job and my other 3 supervisors is to go out there and give support. Sometimes just give them a break, get them off the truck, because they're going to have to do it the next day. And it's going to continue. It's not going to stop. We just have to try to find a way to slow it down. So that's all I have. I thank you for inviting me out to give a little bit different perspective, kind of what goes on the streets.
All right. Good evening, everyone. My name is Caleb Balkman, and I wanted to first thank my panelists for their insights today, and then also to really thank you all for coming out and being a part of this important conversation. And then lastly, I really wanted to thank Kutztown Strong for really putting this together. I think that, we're all talking about what can we do. I think having conversations like this are a part of the solution. So like I said, my name is Caleb Balkman. I am a site coordinator for communities and schools. So I'll be bringing some of my insight from working inside of a middle school. So I have worked inside of the middle school that I work in currently. This is my 4th school year inside of the building, but I started out in this building, so in Kutztown Middle School, Brandywine Heights Middle School, and Fleetwood Middle School. So I've had an opportunity to see the community from a lot of different lenses in that. And I also graduated from Kutztown University, which is actually where I was able to intern with Kutztown Strong and be a part of that community needs assessment that we did. And I think that, those things have given me some insight into, where I am today. So like I said, I'm a social worker. Currently, I work full-time at Fleetwood, and I work every day to support, encourage, and empower young people. So in my role, there are a couple of different things that I do. One of those things is school-wide support. So I support every student in the building through whether it's events, whether it's small groups, and just being an adult in the building that students can go to, a trusting adult that they know will not judge them, and they'll be able to talk about anything if things come up. I also do support students, any and all students, with things like basic needs. So if there's anything that has to do with school supplies or hygiene products, or something goes on at home or an emergency, that is another way that I support students. And then I also support students individually on my caseload. So I have a caseload size, and I work with students individually on whatever it is that they may be struggling with or obstacle that's in their way. So for some students, it's academics. For some students, it's purely behavior or making smart decisions inside of school. And for other students, it is purely social emotional learning or mental health. So giving them a space to process things, giving them a space to talk about things that may be going on for them, or things like attendance and stuff like that as well. So that's a little bit about how I work inside of the building. And I would say my primary role which is the same for every adult inside of the school building, is the safety of the student. So when it comes to specifically the student safety, if it's a student that we may suspect is using substances or are known, then that's where I would refer them to. We have a great relationship with our Karen representative. So we would, put them through our SAT process, our student assistance program, and they would be assessed by that Karen representative. And they would come up with solutions or different resources to provide them. And then when it comes to if there is a student that we suspect maybe their parents are using substances, then that is when we would get in contact with children and youth to make sure that that student's safety is, taken care of. So the first role is making sure that student is safe. Secondly, and kind of to that safety piece, my role is to make sure that students feel safe to process whatever is going on. So when it comes to substance use, we know that it is not an isolated issue, okay? We know that it does not happen to someone around you and that it just does not affect you. We know that it affects you, especially young people and children and teens. So a part of my role is giving them that space to be able to talk about feelings, to be able to talk about thoughts, to be able to talk about how they're coping with it. A lot of times in middle school, our students are just learning how to cope with some of the stresses that happen in life. So a part of my job is giving them some of those skills to use when they are having or going through any of these difficult situations. And then lastly, to give them that safe space to process things like transitions, right? So if they did lose someone, if they are, experiencing something where one of their family members or someone that they know closely is using substances, how do we give them those tools to, whether it's process that grief, whether it's just to reach out for support. So that's another very important part of my role. And then my last, or not my last, but I would say the third really important piece of my role is to empower and connect. So students, whenever they're dealing with any issues like these, anything that has to do with substance use, but just in general as well, mental health, behavior, it's important that they are empowered. So a part of my role is connecting them with some of the resources like we have Caring groups. One of the Caring groups is the Kids of Promise group. So any student that has any type of relationship to, whether it's a parent, whether it's a cousin, whether it's a close friend that has used substances, they can join that group and be able to talk with other students that have those similar experiences. And that is super important because I think that students in particular often do not recognize that they are not alone. A lot of times they think that this is happening with me and my family, and I don't want to talk about it with anybody else because they're going to judge me, or they're going to think that it's something that I'm doing or I'm creating. So giving them those spaces where they can talk with other peers and feel less alone, I think is super important. And then also the connection piece. What I have learned being inside of 3 different middle schools, and then the school that I'm in now, is that our students really, really want to belong. They really want to connect with others. And especially when it comes to substance use, these are ways where we can give them tools and give them places where they can connect with others that have those similar experiences and they can feel less alone. So I would say those are some of the key roles that I play inside of the building. When thinking about kind of a story, a bunch of different stories popped into my head, and I didn't really just have one, but I can share my experience of working with lots of different students inside the building. So I know that there are students on my caseload and students that are not on my caseload that have lost loved ones. They have lost parents, brothers, sisters, cousins, aunts, uncles, and they carry that with them inside of the building every single day. And it's not something that goes away. I know that there are students that have found their parents that have recently overdosed and had to be the ones who made the call. And I also know that any person that we are talking about that may have overdosed or used substances was a student at one point. So the schools are a place where we see pretty much every single individual in the community. Every person has to go through our school system. So it's a great opportunity for us to be able to get at some of those things like stigma, to be able to talk about the coping skills, and to be able to have our students feel less alone. And I also know that the majority of our students know of someone with a substance use disorder. Like many of the panelists up here have talked about the prevalence of this, it is definitely seen every day for me being inside of the building. And then to think about ways that we can make a difference or suggestions for what we can do moving forward, I think the first thing that we can do is acknowledge the pervasiveness of opioid use in our community. Like I said, it has touched almost every student inside of our building in some way. It's obviously touched all of us in some way, which is why we're here. And I think that if we can continue to acknowledge it, then that's when we're able to move past that. But if we act as if this is not an issue or something that is not continuing to happen, I know we've heard a lot of numbers up here, so we know that this is something that is still a steady, growing, increasing issue for us to deal with. We have to acknowledge it. And then secondly, we have to continue to support and advocate for mental health and substance use prevention resources inside of our schools. So like I said, our schools are that central hub that all individuals go through. It is also a central hub for resources, a great place to intervene and to be able to work with students as they are learning about the world, as they're on their life journey. And I think that if we continue to advocate and push for these mental health resources, I know during COVID, there was a huge increase. A lot of us understood, or we learned, that mental health is real, right? Mental health is a struggle and we are all dealing with it. We cannot move away from that now that we're not seeing it in our faces as much when it comes to COVID. That was a highlight for us. That was something that brought our awareness to it. But the truth is that inside of our schools, we need more. We are overwhelmed inside of our schools when it comes to mental health, substance use, and we're seeing more and more every day. So this is not a place or a time for us to, pump the brakes. It's really time for us to push forward, saying that we know that there are these issues. We know that we need the resources for it. So we have to continue to advocate for that and push for that. And then lastly, challenging the stigma and creating opportunities for connection. I think, like I said, conversations like this challenges the stigma that we face. Being honest and vulnerable about not only our experiences, but the experiences of people that we know. And understanding that this is not a personal issue. So substance use disorders are not a personal issue, right? A lot of times we want to label the person, but that is not the problem. This is a community issue. This is a school issue. This is a resources issue. We heard from the professionals that are out there in the day saying how overwhelmed that they are, seeing people every single day, multiple times a day, right? So we cannot deal with this as a personal issue. We have to look at it from a systemic lens and look at what we can do as a community to come together. And that is all that I have. Thank you.
Hello, I'm Dr. Jennifer Ziegler. I am residency trained in emergency medicine, and I currently work in the Reading Emergency Department, which, as I understand, having my last check, is the 10th busiest DR in the country. Before that, I worked in Florida, very close to the infamous, I think it was Brevard County, that had the huge pill mill running through it. They would have buses of people coming down from different states. All right, better. Sorry. But as an emergency physician, I see some form of substance abuse, misuse every single day. And I was trying to think about what was something I could share. And the truth is, when I come in for a 5 a.m. shift, I'm trying to drink enough coffee to wake up. And the first thing I usually get is a sign out with, hey, this guy was brought in by the ambulance crew for altered mental status because of substance use. This person was found down after they were found unresponsive. We think they just need to sleep it off for a few more hours. But the truth is that we never know exactly what someone's taken. And the more you take of any given drug, the longer it takes to break down in your system. And so a lot of times people end up hanging out in the emergency room for an extended period of time. Opiates are tricky because if I give somebody too much Narcan, they will wake up, pull out their IV, try to punch you. You've probably been hit a few times. And then they will run out of the emergency room. And actually, this is a question I may have for you too about capacity. Once someone has capacity, I can't hold them against their will. And so the way that we like to treat overdoses in the emergency room is not to wake someone fully up, but to literally titrate to them breathing, which means I wake them up very slowly. And the reason for that is twofold. One, I don't want them to punch me, but also because if they wake up too quickly and they leave, what if they had overdosed on methadone? Methadone can last 24 to 36 hours. And the Narcan that I'm giving someone, it only lasts for 30 to 90 minutes, depending on how it's been administered. And so that same person who was wide awake runs out of the emergency room and then ends up getting found down the street and re-brought back in by the police because they're unconscious again because the Narcan wore off. And so we try to titrate very slowly to making sure that someone's breathing enough so that they're safe, and we put them on end-tidal CO2 detectors and a pulse ox just to make sure that we're watching them closely, and then we slowly titrate it until the drug that's in their system, whatever it might be, wears off. And as they brought up earlier, there are so many drugs out there. Everybody's heard of morphine. We're older, we've heard of morphine, but fentanyl, to give you kind of an idea of the difference, 10 milligrams of morphine is the fentanyl equivalent is 0.1 milligrams. That stuff is potent. And there's stuff out there, stuff that they're bringing up that is 100 times more potent than even fentanyl. The day that he mentions that horrible day, I worked that day too. It was awful. And, I can't give any specifics, but I can just tell you it was absolute chaos. And, people were getting Narcan left and right. They were leaving, they were coming back again. And, it was a pretty horrific scene. So what can we do? The Reading ER actually has some really neat programs, and I definitely have to give a thumbs up to, there's someone from the Council of Chemical Abuse, hello, who help support, as with Reading Hospital, and I believe it's also TASC and the CCPH, the warm handoff program, which is something I use every day. And what that is no matter what your substance use is, I can offer you treatment. And so we have recovery specialists that are present 24/7. And they literally will go, we call them, and once I have medically cleared someone and I feel like they're actually safe, I ask them if they're interested in any form of rehab. And even if they say no, I'll still call our recovery specialist just so that they can touch base with them and give them resources. But then they'll work to try to place them straight out of the emergency room. So they don't go home, they don't pass go, they go straight to rehab. And it's a fantastic program. If they decline, at least we're there, we give them resources. I always make sure someone goes home with a free Narcan kit, which I think is great. And we explain how to use it if they don't already know. But there's other options too. A lot of times we can offer to start someone on, I don't know if anybody's heard of Suboxone, which is an opioid agonist, and it's actually mixed essentially with Narcan. And the only reason they do that is so people can't grind it up and then snort it and use it without it. So as long as you mix it with Narcan, then it can't be used for abusive potential, but it helps get people off of a substance that's so tricky. Methadone, people have heard of that. Methadone is another option, but we're finding that Suboxone is, in a lot of cases, far superior to that. The tricky thing is you actually have to be in withdrawal to start the Suboxone. But I could go on and all day, but
Good evening, everyone. I am Gail Greth, the Magisterial District Judge for Northeastern Berks County, serving the areas of Fleetwood and Kutztown and beyond. We have a 24-hour, 7-day-a-week court system here in Berks County, so not only do I serve the Fleetwood, Kutztown, and surrounding areas, there are times where I'm serving the entire county of Berks. As a magisterial district judge, let me say that I do recognize that there is a drug problem here in this area. I cannot commit in a public forum to taking a stance on whether I will or will not put people in jail. I cannot commit to a particular result in my courtroom. I have to hear the facts, I apply the law, and I protect the rights afforded to those who come before me. I do my best to try to address underlying issues that may have contributed to someone's behavior, which caused them to commit an offense that resulted in them having to appear before me. I consider myself a community resource in those respects. It's very difficult because I may see an individual for 5 minutes, 10 minutes, 20 minutes, depending what they're charged with. They may have a couple hour-long hearing in front of me. I may not even have the opportunity to interact with them one-on-one, depending what they're charged with. I can only hear the case, make a determination if it's a serious crime, whether the case moves on to the Court of Common Pleas or not. I hear a lot of minor criminal case, and a lot of our youth are coming in front of me type cases. We in Berks County have a second chance program for those who come in front of us for minor offenses for first-time offenders. And this program was implemented in cooperation with the Berks County District Attorney's Office because what I was seeing over the years was the impact that these offenses were having on our youth after they left high school, after they left college, because it created a public record for them. That concerned me. And an example I want to cite is a young man who graduated from Kutztown University, and he went to Virginia for a job interview, and he was interviewed at an insurance company for a position. And at the end of the interview, he thought he did fantastic. The person interviewing him said, "Now tell me about that disorderly conduct you had in Kutztown, Pennsylvania." The young man came back to my court and got a copy of the transcript and went through the expungement process to have that sealed from public view. Because let's face it, our young people do make a lot of mistakes, but do we want that to penalize them throughout their lifetime? No, we don't. We want it to be a learning experience. Yes, they may have to be penalized. We want it to be a learning experience, and we want them to be able to clear their record if it was a minor offense and not impede them from being successful citizens in our society. Yes, people are held accountable for their actions in the court, whether or not they are under the influence of alcohol or a controlled substance when they committed the offense. That has no bearing. They cannot use that as a defense. The programs that I utilize, I just want to mention the areas of education that I generally assign to individuals if they're charged with a minor offense, where they can complete a mini course to have a charge dismissed and then expunged. I am assigning individuals in the areas of alcohol education, anger management, drug and alcohol awareness, offender education courses, driving under the influence, life skill mini courses, marijuana, THC education, retail theft, shoplifting, impulse control, vaping and nicotine awareness, parenting skill classes, because I do see parents, truancy intervention for students and parents. When I have a truant student in front of me, my goal is to keep that student in school, because we know if they get their high school diploma that they will be more successful in life and they will live a more fulfilled life. My goal is to keep them in school. I work with those cases sometimes for months to bring about compliance within the school system. And I recognize that sometimes drug and alcohol, is an underlying factor. I can tell you that in minor offense situations where I am able to dismiss a charge in exchange for education or community service or, some kind of diversionary program, I hope that I've had some impact on that individual. As in criminal cases, serious cases that are of mid-grade and more serious offenses, misdemeanor and felony cases, I may be processing someone and setting bail and making a determination of whether they will be released on bail or committed to the county prison to await their hearing. So when bail is set, I consider that an intercept point. I can condition an individual who's charged with an offense to report to Berks Pretrial Service Agency, who is an agency that we work with to keep offenders out of the prison system and to help them. I can order a drug and alcohol evaluation. I can order follow-up work if deemed necessary following that drug and alcohol evaluation. We work with the Council on Chemical Abuse and other agencies to try to help individuals as soon as they come into the justice system. As Dr. Jennifer Ziegler stated to me when I sat down here, and I said, I'm not sure what I can contribute here because I'm the person that has to impose the penalty, and I only get to see people for a very short time frame. I'm hoping that I make a difference, but I don't know whether I am. She said, yes, their goal would be not to be in front of you. And I said, absolutely, that would be a goal for someone not to be in front of me. But as I said, I do view myself as a community resource. I want citizens to recognize and address, their underlying issues, whether they are addictions that they have or mental health challenges. It does help for us to help these individuals to address these issues. It helps society. It protects us. It helps our economy. It's a win-win situation. When I look around the room, I see so many of you that I know. And sometimes when I come to these forums, I feel like I'm preaching to the choir. But because you care enough to be here this evening, and me preaching to you, and I know that you are going to preach to someone else and share the information that I've provided to you this evening, I am very thankful and grateful to be here this evening, to be a part of this forum, even if I am the person that only sees individuals for a very short time frame, and sometimes all I can do is to impose a penalty. People have to obey the laws, so I do my best to try to help them if I can support them in some way, if I can help them with underlying issues and just point them in a direction. Here in our community of Kutztown and Fleetwood area, we have tremendous resources. I work with a lot of the university students, and I can tell you that the administration here in northeastern Berks County and at the college level, they generally care about our youth, and they are doing everything they can. The university pays to get copies of everything that comes through my court that is a minor criminal offense or a major criminal offense. And they are doing that so they can reach out to those students and help them. And I coordinate with them not to impose the same online courses that they impose if I impose a course as part of a penalty phase. So we do work together. The school districts, the colleges work with the judicial system, and you did not have that 30 or 40 years ago, as Sergeant Skavinsky alluded to. When I came in, it was tough on crime. We needed to put people in prison. Now we are trying to keep people out of our prison systems because they don't belong there unless they've committed serious crimes. So we are trying to help those people that, especially have committed minor crimes that are coming before the first branch of the judicial system, which is the branch that I serve on. I want to say that I am thankful for all the community resources that I have that work with the court. I especially want to share with you on the back of one of my Community Plus pamphlets, a Bible verse that is listed there. And it was provided to me by Pastor Nate Herlin of Cornerstone Community Church, who's with us this evening. Thank you very much. And I reflect on it a lot, and I hand this out to individuals. And I'll close with saying this: no discipline seems pleasant at the time, but painful. Later on, however, it produces a harvest of righteousness and peace for those who have been trained by it. And that's in Hebrews chapter 12, verse 11. And I'd like to close with that. Thank you very much.
Aha, I'm the last panelist, so I'm very happy to be here today with you folks. What's a little bit different, I decided to share who I am and separate from what I do. I think that this is awesome with all the resources that are here available. I am in awe sitting with this distinguished panel. So this is about me. Good evening, my name is Frances. I am here to share me with you. This is the first time I'm sharing in public that I'm a person of long-term recovery. Today we discuss people with substance use disorders. This is a face of someone who lives with a substance use disorder. It's a humbling experience to be here. But what I do hope, as Kutztown Strong was preparing this, I had many conversations with Sue. I could come here and talk about what I do. I'm very active as a preventionist in alcohol and drug, kind of like Brown. I've been doing it for decades. But I'm able to share in public because my loving mother had passed at the age of 91 over the summer. And I had to have a discussion with my brother because I knew it was time for me to step forward. I say this mantra in some of my meetings: if not now, then when? When do we separate and look at how do we conquer the stigma? Today, when I was preparing for this, I was thinking about all the faces that have recovered and a lot of faces that are not here with us today. A lot of people think that marijuana is such a mild drug. But what I can share, my life experience has been those who started with marijuana ended up, it was a primer of things to come, a primer, a look into an illegal world, a primer to show people what hardware that a person can create to do the drugs. So when I think about that, and there's people that it does work for them, but that's between them and their practitioner or their people, but I see the harm. I would love to go to a family reunion and spend time with my cousins. But for them, it was the primer of a destructive life. I listen to hear the information shared and what's offered in the middle school. I come from a different generation where people look the other way. I started my use in middle school. I sit around tables where people discuss and they look at, oh, how do people get there? There's a whole lot of moments in my life that are not my proudest moments. When people look on the social media and they look at Kensington, where they talk about the trank drug, the combination of drugs, and sometimes people will say, well, they look like zombies. There was a life where I knew Kensington was a place to go and do cheap shopping. But when I see those videos, I see a mother, a sister, a cousin, a child, and I see a father, I see a brother, I see a sibling. I see that, and my heart cries for it. When people say, how do people get there? There's moments that I was reflecting this morning, streets in Philadelphia, where I went to purchase drugs, places in Allentown where I went to purchase drugs. But you know what the crazy part of it was? No one knew. My mother had no clue. I hid it well. My brother, I was at a party over the summer, and it was a birthday party, and I pulled him aside, and I said, do you know I'm a person in long-term recovery? Because most recently, he lost a dear friend due to alcohol abuse because he had cirrhosis of the liver, and he felt very guilty. And I just advocated, well, he made his choices. He lived his life the way he wanted to live it. There was nothing you could do. The person decided to keep it silent, but all you could do is just honor his memory. So today, when I was thinking about being here, today I think about those who feel the pain of substance use disorder. I am one of them. Can you imagine me entering into a relationship? I'm widowed now, but I have to have that conversation. I have to share with a partner my least proudest moments in my life. Also, too, I think about my sisters and my brothers that continually hold that cactus. They know it's uncomfortable, they know it hurts their family, but they're not in that frame of mind. So I think about those who hug that cactus. I think about those who live their life as taken one day at a time. I'm one of them, right? Family and friends and loved ones whose hearts break. There are times, as me being an advocate, and I've done it in a quiet way, where I'll receive phone calls on New Year's Day. I think I've received 2 of them, where someone says, Fran, can you help me? Because my adult child is ready for treatment, but everything is closed. So I have a network of people, I'm a connector, and I kind of assign people to that and hope that, while their adult child is ready for treatment. When I found out that Narcan existed, because I was in the program of the first cohort of opioid treatment addiction program, that was the brainchild of Rachel Levine, and it was offered at Clarion. When I found out about Narcan, I was singing the praise and telling everybody I can. 2 years ago, a dear friend told me, because I said, you could get it at the pharmacy, it costs X amount of money, and things like that. He shared with me that not only once, but twice he had to revive his adult son. But he kept it in his home, not knowing if he had to use it. Also, too, I often hear over the years, I did not know how bad it was. So when I think of things, and everybody's here today, and trust me, this is a risk because they're taking this. But when I think about it, we are all here today, and if we could help one person, all of us have experienced loss. Maybe some people haven't yet. I envy them, but we've all experienced loss. But there's one thing we wish. We always wish that we have one more day. So when people talk about the political use of using Narcan, whether or not to keep it in the house, things like that, I keep it because it's part of my medicine chest. So what I can tell you, I will be forever grateful to my friend, his name is Al, who pulled me aside in my early 20s and said to me, and I'll say it in a kinder way tonight, "What the heck are you doing, Fran? You're gonna lose everything. Everything." Now, this particular gentleman, I would rip and run, I'd go to the bars, blah, blah, blah. You know, I partied with him. I was a happy partier. I could have sat there and thrown a lot of daggers at him, but I sat and listened. And that was the day I started my journey of being a sober me. I didn't know how to do it. I kind of figured it out. I rolled forward to doing cartwheels. And sometimes there were slip-ups. There was things that I could say, well, you know, my drug of choice I can't use, but maybe I could have alcohol, right? I toyed with that for a little bit. Often I sit around the tables and they said, well, you know, alcohol's better than using drugs. Is it really? It could end up hijacking someone's world. When I wrote and thought about this, and I do morning reflections for people that know me, my eyes were tearful as I wrote this. All I can tell you, a day at a time, a week at a time, months at a time, I am an example of a person of decades that I have loved a life of sobriety. I had some bumps and bruises along the way, but what happens is, if not now, then when? When are we going to say enough is enough? Also, too, being a person of long-term recovery, it is truly one day at a time, even though I have decades. There's times, you know, I shared with you, my mother passed away. I had friends, I said, check in on me in 3 months. Just make sure that I'm not making dangerous decisions for myself. And they do. Also, too, I love my life being sober. I work with the population when they come and they have made some wrong decisions. I always say that a day of a bad decision, because bad things happen to good people, or a series of bad decisions should not preclude you in the life you can live. So I kind of said that, I guess when we were coming up what to do, I could put all that stuff that I do, but what I do now is that I wanted to provide an opportunity to put a face to everything we were talking about today. People can discover, each person takes their own road to sobriety. I am blessed that I had an opportunity to clean that foggy mirror and see me and love me. I've also stood next to people where they're in awe and they're like, oh my gosh, this is the best they talked about, because often in treatment facilities and in recovery communities, they said the best is yet to come. So today, what I wanted to do for those who are visual learners, the Council on Chemical Abuse happens to have these cards. You scan the QR code if you have a smartphone, borrow someone's if you don't. This packet was mailed to me. Okay. So the Council on Chemical Abuse can order, you could scan it for free to get a medication lockbox, right? Because what we do know is that sometimes our youth will go into medicine cabinets and seek out drugs and start taking them that way. Also, in addition, disposal for your drugs in your home, in your cabinet. I had ordered them, and then, my Narcan kit is probably gonna come, that they could mail you a Narcan kit. All you gotta do, QR code, scan it, it gets delivered to the privacy of your home. If you're someone that does camping over the summer months, put it in your camper, because you don't know who's setting up next to you. There is no shame in the game. But what we can do and we don't see the effects, is stop being silent and stop the stigma and saying, we're gonna be okay. We're gonna be okay. There's marvelous things that people here on the panel do. Now, I'll probably end up like having a hot cup of cocoa after I leave, because this is scary for me to share. But I think it's very important. So what I do is I challenge people when you leave today that you talk to people. Like, I'm the biggest cheerleader of like alcohol and other drug prevention, but some people tonight are probably in awe that I shared this personal part of me with you folks. So that's all I need to say. Thank you.
I'd like to say yes. I am in awe. Fran, I've known you for how long? I am in awe. And I really appreciate everything that all of our panelists have shared tonight. We have gone over, but we do want to answer your questions. So if you have questions, if the Kutztown Strong people could collect those, and we'll do our best to answer those. Obviously, if you have to leave, we understand and we're sorry, but I think everything that everybody shared was too important to cut short, so.
While they're collecting cards, I was admiring the In the Spirit of Keith Haring that's hanging in the back of the room. And I don't know how many others up here were thinking how that symbolizes some of the lives that we work with, just constantly up and down. So I really appreciate having the view of that as we, progress through our evening. It's wonderful.
Thank you for noticing that. Our first question is, where is the nearest medication drop box? I'm looking at Sergeant.
The top floor of the Borough Hall has a drop box. If you come after hours and it happens to be locked, please ring our bell out front at the police station. One of our officers will come in and help you access it. Because sometimes you have them in your car and you want to get them out of your car. And so we recognize that. If you go up there and the door's locked, you forget to take it when you're paying your bills, just come down to our call box. If we don't answer the door, ring the call box, wait a few minutes, I'll have an officer in and he'll help you take care of it.
There is also one in the Fleetwood Community Center on Arch Street, in the main lobby of the hallway in Fleetwood.
I've used the drop box in Kutztown. When my mom passed away, there were medicines that needed to be disposed of, and it's very easy to use, very easy to find, and it's a good thing to do. I will say one other thing about the elderly. As we age, sometimes we become forgetful, and they will forget that they have taken their medication, so they take it again. I know I've called the Poison Control Center for my dad a couple times, and so it's not necessarily intentional, but sometimes it is accidental. So remember those things too. But boy, if you're working with elderly people in your family, and if there are drugs that they are done with, but they are opioids, get rid of them. Another question. I've heard that substance misuse is a family disease. How are other members affected by this disease, and how can they receive help?
Hi, I could tell you my journey. My grandparents were known for having a substance use disorder. My father, I would think, would toy around and get a little too loaded. But what I did find out is that I happen to have, I don't know if they call it an inherent gene. So the only way to avoid, because I have a beautiful family, I live a good life. I've explained and educated my daughter, because one day she was taking classes at the local university and she said, "Mom, you talked about addiction, but I don't share my war stories of me with her." And she goes, so in other words, if I start going out drinking, I could become an alcoholic. I'm like, yes. I said, the only way that you could beat this is don't use the substance and live your best life. But also too, you have to be very mindful of behavioral patterns, things like that, because addiction comes in many different formats. Gambling, other things, things that are hard, and also what the commonality is compulsive behavior that's coupled with either use or an action. But not everybody in a family will get it. You may find yourself having siblings that could drink socially. It's kind of like if you have a chance, I think there was a Jack Lemmon movie called The Times of Bread and Roses, where it talks about a journey. But the only best way to do it is change these dynamics, break the pattern, educate your family, and encourage them to live their best self. Thank you.
Go ahead.
I'd like to add on as well that it can impact family members with regard to trust, safety, physical and emotional safety, boundaries. There's a lot of balance that family members have to learn through treatment as well. A lot of people think you send a loved one away to treatment and all will be well when they come home. Some people think, the hard part is over when, they finished going to a 30-day treatment. And oftentimes it's not the hard part. It is acclimating back at home and all the family members learning how to navigate this. How do family members, how do they provide support yet healthy boundaries, right? How do they allow their loved one to have room to make mistakes and carve stuff out for themselves, yet at the same time remembering that there was a big reason why they couldn't trust their loved one. But to make sure there's a balance in these things, I think there's a lot of education that family members can go through. Karen, along with the education programs that were mentioned, they have family support groups. Donna, I know you mentioned that. They have sibling support groups. So if you need any resources, there is a sheet back there. You can get my card. If I can connect you with any of the educational resources, it's not just treatment, but it's also education for the family on how to navigate that.
Thank you. I think this question is probably for Gail Graff, I'm guessing. What is a drug court? Do we have something like this in Berks County?
Yes, actually, we do have a drug court on the Court of Common Pleas level. It's not on the magisterial district level, so I don't participate in drug court, but I do hear the cases and make a determination of whether an offender has committed a misdemeanor or felony drug offense, and it moves on in through the drug court where the probation office and the judges and the various agencies that individuals are connected with to help them address, whatever their addiction is or whatever their underlying issue is. Yes, Berks County is very fortunate to have a series of courts that specialize in different areas. We have a drunk driving court. We have a drug court. We have a domestic violence court. We have a veterans court. So when I process someone, it is noted on the arraignment form if someone is a veteran. What branch of military did they serve in? What was the reason for your discharge? Honorable, dishonorable? And that information is passed on to the judges of the Court of Common Pleas, so a red flag can go up that maybe they have some mental health issues, maybe they have some underlying issues that need to be addressed from serving in our military. So I'm very proud of the various courts that we have here in Berks County that are trying to help individuals, and our probation and parole offices are very overwhelmed with the number of cases that they have and the number of people that they're supervising. And our probation and parole offices carry a lot of power over people. They can knock on your door and come inside, and if they see something, they can rip your house apart. And they really, really have strict guidelines when someone is on probation or parole. They have individuals that are submitting to tests, on a weekly basis to make sure they're clean and they're staying in their program and they're monitoring them. So a lot of good things are happening here in Berks County, and that has changed. As I said, I'm in office for 42 years. When I came into office, there were no specialized courts. It was criminal court, it was civil court, and miscellaneous court. That's it. So we've come a long way.
A lot of these questions have been answered through the speaking of the panelists, but there is another one that I would like to read. It says, what are the similarities and differences between 211 and 988 services? How and when should each be used? And I'm guessing that's probably for Marcia or Dr. Roberts now.
I can only speak to the 211, but fortunately in Berks County, as well as other surrounding counties, there's a number you can call. Obviously, we all know what 911 is about. But if people need access to services, 211 serves to be able to know what services are available in our county, how to make referrals, how to give people the information so they can be readily connected. There's something I'm going to add here too that's unique that I didn't get to talk about that we're going to be having coming to Berks County thanks to our partnership with Penn State School of Medicine. We are going to be having a vending machine that's a resource vending machine. And the reason I'm connecting this with 211, if you can imagine a vending machine that looks like a large iPad screen, that the only thing you need to do is touch that screen and it's going to connect you to services. This machine's going to be dispensing Narcan, fentanyl test strips, sanitary resources, medication disposal bags. But why it connects to 211 is when you touch the screen, if you need help, it's going to automatically then connect you with 211. So that we have this unique with technology growing where it is. And I'm getting so excited. The machine, by the way, is done by a company that's located in Vancouver, Canada, called Smart One. So probably early January, it's going to be delivered to the YMCA in Berks County. Well, that's pretty. And we're going to let you know about it. But why we think it's important for you to hear about it now is if this is successful, we'll be looking for funding to have these user-friendly vending machines located throughout Berks County. So it's another way of building upon 211.
Thank you. And I think
add a little bit to that as well. 988 is more specifically suicide prevention, and then 211 is more specifically just general services.
Okay, thank you, Caleb, thank you. So there are those two different numbers and they are for different purposes. I don't want to hold the panelists any longer because we had said we'd end at 8 and I'm very sorry. So we can't thank the panelists enough for coming out tonight. We can't thank you for coming out tonight for this very important conversation. As we like to say in Kutztown Strong, it was mentioned earlier, together we are stronger. So thank you very much for coming and good night.
It's a pretty